What if your morning coffee could actually help control your blood sugar instead of making it worse? I'm Dr. Franklin, and today I'm going to show you one simple, science-backed tweak to how seniors drink coffee that can improve blood glucose patterns without expensive drugs or complicated diets. Aging changes the way our bodies handle sugar. Muscle mass declines, so there's less tissue available to pull sugar out of the bloodstream. The insulin-producing beta cells in the pancreas become less responsive, and many older adults face the dawn phenomenon, a natural early morning rise in blood sugar driven by hormones that prepare the body to wake up. Put those together, and it's no surprise a lot of people over 60 either have pre-diabetes or higher fasting glucose than they'd like. So where does coffee fit in? For decades, people have debated whether coffee is friend or foe for blood sugar. The current picture is nuanced. Coffee contains several bioactive compounds that can actually help blunt glucose spikes and improve fasting levels. But the timing and composition of that coffee matter. Two compounds deserve the spotlight: chlorogenic acid and trigonelline. Think of chlorogenic acid as an intestinal traffic cop. It slows the rush of carbohydrates into the bloodstream by inhibiting enzymes in the gut that break complex carbs into sugar. That means a smaller and slower post-meal glucose spike. Trigonelline plays a different role, more like a gentle reminder to the liver. It nudges the liver toward taking up excess glucose rather than dumping it back into circulation, which helps lower fasting sugar. Importantly, these compounds are not tied to caffeine alone. High-quality decaffeinated coffee retains much of the chlorogenic acid and trigonelline, so decaf can still deliver many of these benefits. So far, so promising. But I see the same 3 mistakes in clinic every week, habits that turn coffee from a potential helper into a contributor to higher blood sugar. The first mistake is drinking caffeinated coffee immediately on waking. Why is that a problem? Because of the dawn phenomenon. In the early morning, your body pumps out stress hormones like cortisol and adrenaline to kickstart the day. If you add caffeine right away, you amplify that hormone signal. The result can be an exaggerated morning glucose spike and a higher fasting reading than you'd expect. I once saw a patient, let's call him Walter, who did this every morning. His fasting glucose readings were stubbornly high. When we delayed his first cup, those morning numbers came down. The second mistake is adding sugar or relying on many artificial sweeteners. A spoonful of sugar undoes much of coffee's protective effect by adding immediate carbs. Some non-nutritive sweeteners can also change the gut microbiome in ways that studies suggest may interfere with glucose regulation. That doesn't mean every sweetener is always bad for every person, but the safest approach, especially for seniors watching blood sugar, is to drink coffee plain or use minimal alternatives like a small amount of pure stevia if needed. The third common error is late-day coffee that hurts sleep. Caffeine's half-life varies, but for most adults it lingers for several hours, typically a range around 3 to 7 hours. If you drink coffee late in the afternoon, it can reduce sleep quality. Poor sleep impairs insulin sensitivity the next day, creating a vicious circle. Worse sleep, worse glucose control, more reliance on stimulants. That's one reason a shift in timing, not just quantity, can make a noticeable difference. So there are the problems. Now here comes the simple trick: timing. Clinical studies and physiological research point to 3 practical windows when coffee is most likely to help metabolic health for older adults. These are precise, repeatable, low-cost changes you can try. The first window is a delayed morning cup. Wait 45 to 90 minutes after waking before you have your first coffee. In that interval, hydrate with water and have a small protein-rich bite: an egg, some Greek yogurt, a handful of nuts, or cottage cheese. Why this order? Eating a little protein first gives your pancreas and muscles a head start at handling glucose and blunts that early hormone surge. Then when you have plain coffee 45-90 minutes after waking, The chlorogenic acid can slow carbohydrate absorption from later meals, and trigonelline can support lower fasting glucose. Optional, a pinch of Ceylon cinnamon, about 1/4 teaspoon, stirred into your coffee can be pleasant and may add a small benefit in some people. Make it plain. Avoid sugar or flavored syrups. The second window is a pre-meal cup. 20 to 30 minutes before your largest meal of the day, have a small plain coffee. The idea here is to prime the gut enzymes and the liver so that the carbohydrate load from the meal produces a smaller spike. Think of it as a warm-up for your metabolism. Keep the cup modest. A small mug or 6 to 8 ounces is plenty. For people who are sensitive to caffeine, a small decaf works for the enzymes and liver effects. For the caffeine-specific interactions, you may prefer regular, but only if your physician and your own tolerance allow it. The third window is post-exercise, within 30 minutes after a bout of activity. Exercise, even a brisk 10 to 20-minute walk, activates a muscle transporter called GLUT4, which moves to the muscle surface and helps pull glucose into muscle cells independently of insulin. Research suggests caffeine can prolong the period during which muscles remain good at taking up glucose after exercise, creating a stronger and longer post-exercise glucose sink. So having a small coffee within 30 minutes of your activity can extend that benefit. If caffeine provokes palpitations or anxiety for you, choose decaf and still prioritize the walk. The movement itself is the most powerful part. A few practical details to make these windows realistic. For the delayed morning cup, set a simple routine. Drink a glass of water as soon as you wake. Eat a small protein, hard-boiled egg, a 3-ounce portion of Greek yogurt, or a tablespoon of peanut butter on whole-grain toast. Wait 45 to 90 minutes, then enjoy plain black coffee or coffee with a splash of milk. Avoid sugar, avoid flavored creamers. If you need sweetness, a small amount of pure stevia is a reasonable alternative. If you have GERD or a sensitive stomach, try low-acid coffee or take the protein first and delay coffee closer to the 90-minute mark. For the pre-meal cup, choose the meal that tends to raise your blood sugar the most. For many people, that's lunch or dinner. Have a small plain coffee 20 to 30 minutes before you eat. Keep portion size moderate. Pair that meal with protein and vegetables to further blunt spikes. For the post-exercise cup, aim to have coffee within 30 minutes after activity. If you exercise in the morning, that can be the same cup as the delayed morning window. Time it so that the coffee follows the movement. If you exercise later in the day, make sure the post-exercise cup does not interfere with your sleep. For late-day workouts, decaf is an acceptable compromise. Let me give you 2 real examples from my practice, anonymized composites that illustrate how small timing adjustments can add up. These are not guarantees, but they show what's possible for some people. Walter is 74, a retired engineer who used to drink 2 large caffeinated coffees immediately on waking and add a packet of flavored sweetener. His fasting glucose was often in the mid-130s mgdl, and his A1C hovered around 7.6%. We moved his routine, water on waking, a small Greek yogurt for protein, then a single cup of plain coffee 60 minutes later. He stopped the sweetener. He also added a short 15-minute walk after breakfast and a small pre-lunch coffee 25 minutes before his main meal. Over 3 months, his average fasting glucose fell by about 15 to 20 milligrams per dl, and his A1C dropped roughly half a percentage point. He did not change his prescribed medications without consulting his doctor. This was an adjunct to his existing plan. For Walter, timing and composition of coffee made a measurable difference. Margaret is 69, a retired librarian who loved her late afternoon espresso and often topped it with a sweet biscuit. Her sleep became fragmented, and her fasting glucose and A1C were edging upward. She made 5 incremental changes, Switch to plain filtered coffee, move her main morning cup to 75 minutes after waking following a boiled egg. Add a small pre-lunch cup 20 minutes before her meal, eliminate the late afternoon espresso and replace it with an afternoon walk and herbal tea, and use decaf when she socialized in the evening. Over 4 months, she saw steady improvements in both fasting glucose and her A1C. Again, individual results vary, but she reported better daytime energy and steadier readings on her home monitor. If you try this, here are some practical do's and don'ts to keep things safe and effective. Do: wait 45–90 minutes after waking before your first coffee and eat a small protein first. Use a small plain coffee 20–30 minutes before your largest meal. And D, have coffee within 30 minutes after exercise to extend the muscle glucose uptake window. Choose decaf if you are caffeine sensitive. Decaf still contains chlorogenic acid and trigonelline. Consider a small pinch, about 1/4 teaspoon, of Ceylon cinnamon if you like the flavor. It's optional and may add modest benefit for some. Keep servings moderate, small mugs, not jumbo travel cups. Don't drink caffeinated coffee right out of bed on an empty stomach. Add sugar or sugary syrups to your coffee if you are trying to control glucose. Rely on late-day caffeinated coffee if it disrupts your sleep. Assume these changes will replace medications or clinical care. Safety and personalization are essential. If you're on diabetes medications, especially insulin, sulfonylureas, or other agents that lower blood sugar, do not alter doses without talking to your prescribing clinician. Coffee and caffeine can interact with medications and change how quickly a drug is processed. People who are slow caffeine metabolizers, often due to genetic differences, may experience prolonged effects, sleep disruption, jitteriness, or higher blood pressure. If you have GERD or a history of reflux, coffee can aggravate symptoms. Try low-acid roasts, decaf, or position the coffee after a more substantial breakfast. If you have advanced kidney disease, check with your nephrologist. Some medical conditions call for tailored fluid and caffeine guidance. If coffee causes palpitations, anxiety, or tremor, cut back or switch to decaf. Decaffeinated coffee retains many of the beneficial compounds discussed earlier, although the immediate caffeine-linked post-exercise synergy may be blunted. For people sensitive to artificial sweeteners, natural options like a small amount of pure stevia are reasonable, but remember that even stevia can have different effects on individuals. Evidence suggests some sweeteners may alter the gut microbiome in ways that could affect glucose control. We need more research, so using the smallest effective amount is prudent. A few more technical points explained simply. Caffeine's half-life varies widely, commonly around 3 to 7 hours, so a cup in the late afternoon can still be active at bedtime. Poor sleep reduces insulin sensitivity the next day by measurable amounts. Exercise activates GLUT4 transporters in muscle, and those transporters can stay active for hours after activity. Research indicates caffeine can extend that active window in some people, improving how long muscles pull sugar from the bloodstream. Chlorogenic acid works in the gut to slow carbohydrate breakdown. Trigonelline influences liver handling of glucose. These mechanisms are part of why timing and composition matter. Let's summarize the routine I recommend seniors consider experimenting with after checking with their clinician. Morning, hydrate on waking, eat a small protein, egg, Greek yogurt, nuts. Wait 45 to 90 minutes, then have a small plain coffee. Optional 1/4 teaspoon Ceylon cinnamon. No sugar. Tea, pre-meal, 20–30 minutes before your largest meal, have a small plain coffee to blunt the post-meal spike. Post-exercise. Within 30 minutes after activity, have a small coffee to extend muscle glucose uptake. If caffeine is a problem for you, use decaf, but keep the activity. If you want to try this, track results the same way we track any clinical change. Monitor fasting glucose and A1C over months. Note sleep quality and share data with your clinician. These are low-cost interventions with real potential, but they are not a substitute for medical care. If you notice symptoms like dizziness, lightheadedness, unexplained palpitations, or very low glucose readings, seek medical advice promptly. Before I close, if this message is useful, hit like and tell me where you're watching from in the comments. I read them, and it helps me understand what matters to you. To finish, one short recap. Don't drink caffeinated coffee immediately on an empty stomach. Avoid added sugar and avoid late-day caffeine that ruins sleep. Instead, try the 3 windows. Delayed morning after protein, 45-90 minutes. Pre-meal, 20-30 minutes before your main meal, and post-exercise within 30 minutes. And tailor choices to your tolerance and medical conditions. Talk to your doctor before changing anything about medications. If this helped, share it with a parent or friend who cares for a senior. It could change how they manage blood sugar. Subscribe for more practical, evidence-based tips. Next time, I'll walk through the breakfast foods that quietly spike glucose and how to choose smarter options.